Hey there, future nurses. Welcome back to Good Nurse, your #1 resource for all things nursing. Today, we're diving into an essential topic that every nursing student must master: fluids and electrolytes. This comprehensive guide will cover everything you need to know, provide detailed case studies, and offer 3 helpful mnemonics to aid in your study. So, let's get started. Understanding fluids and electrolytes. First off, what are fluids and electrolytes? Fluids in the body are primarily composed of water, essential for various physiological functions. Electrolytes are minerals in your blood and other body fluids that carry an electric charge. They're vital for regulating nerve and muscle function, hydrating the body, balancing blood acidity and pressure, and helping rebuild damaged tissue. Common electrolytes include sodium, potassium, calcium, magnesium, chloride, bicarbonate, and phosphate. Fluid compartments. The body's fluids are distributed in different compartments. Intracellular fluid, ICF, fluid within cells, making up about 40% of body weight. Extracellular fluid, ECF, fluid outside cells, including interstitial fluid, plasma, and transcellular fluid, making up about 20% of body weight. Fluid and electrolyte balance. Maintaining the proper amount and distribution of body fluids is crucial. Fluid balance involves intake through drinking and food, and output through urine, feces, sweat, and respiration. Similarly, electrolyte balance involves intake through diet and supplements and output through various bodily fluids. Common electrolyte imbalances. Let's dive into some common electrolyte imbalances. Hyponatremia, low sodium. Causes include excessive water intake, heart failure, and diuretics. Symptoms range from nausea and headache to seizures and coma. Treatment involves fluid restriction and sodium replacement. Hypernatremia, high sodium, often caused by dehydration and excessive salt intake. Symptoms include thirst, dry mouth, and restlessness. Treatment focuses on fluid replacement. Hypokalemia, low potassium, caused by diuretics, vomiting, and inadequate intake. Symptoms include weakness and muscle cramps. Treatment involves potassium supplements. Hyperkalemia, high potassium, often due to kidney failure or excessive intake. Symptoms include muscle weakness and arrhythmias. Treatment includes medications to lower potassium and dialysis. Hypocalcemia, low calcium, caused by hypoparathyroidism or vitamin D deficiency. Symptoms include tingling and muscle cramps. Treatment involves calcium supplements. Hypercalcemia, high calcium, often due to hyperparathyroidism or cancer. Symptoms include nausea and confusion. Treatment involves hydration and medications. NCLEX. Case studies. Fluids and electrolytes. Case study. 1. Hyponatremia. A 65-year-old female with a history of heart failure presents with confusion, headache, and nausea. Her sodium level is 125 MEq/L. Assessment. History of heart failure and increased diuretic dosage. Interventions. Fluid restriction, sodium replacement if severe symptoms, and regular monitoring. Outcome. Sodium levels normalize and symptoms resolve. Case study 2. Hyperkalemia. A 50-year-old male with chronic kidney disease presents with muscle weakness and palpitations. His potassium level is 6.5 MEq/L. Assessment. History of chronic kidney disease and missed dialysis sessions. Interventions. Administer calcium gluconate, insulin, glucose, and arrange for urgent dialysis. Outcome. Potassium levels decrease and cardiac rhythm stabilizes. Case study. 3. Hypocalcemia. A 40-year-old female with a history of thyroid surgery presents with tingling in her fingers, muscle cramps, and a positive Chvostek's sign. Her calcium level is 7.0 mmol/dl. Assessment. Recent thyroidectomy. Interventions. Administer intravenous calcium gluconate. Provide vitamin D supplements and regular monitoring. Outcome. Calcium levels normalize and symptoms resolve. Bonus: 3 mnemonics for fluids and electrolytes. To make studying easier, here are 3 helpful mnemonics. Salt loss for hyponatremia. Symptoms: S, stupor, chach, coma. A, anorexia, nausea, vomiting. L, lethargy. T, tendon reflexes decreased. L, lymph muscles, weakness. O, orthostatic hypotension. S, seizures, headache. S, stomach cramping. Murder for hyperkalemia. Symptoms: M, muscle weakness. U, urine, oliguria, anuria. R, respiratory distress. D, decreased cardiac contractility. E, ECG changes. R, reflexes, hyperreflexia or ariflexia, flaccid. CATS for hypocalcemia. Symptoms: C, convulsions. A, arrhythmias. T, tetany, muscle spasms. S, stridor and spasms. Conclusion: mastering fluids and electrolytes is essential for any nursing professional, especially when preparing for the NCLEX exam. By understanding the basics, recognizing common imbalances, and applying knowledge through case studies, you can enhance your clinical skills and boost your confidence. Use the provided mnemonics to aid in memorization and recall during your studies in clinic.